Man, it's awesome to be here. Planetary Health First, Mars Next. We are with a super amazing founder, Darren. I'm so excited that I got to meet you at the Health Innovation Pitch Party. Darren, before we get going,
Likewise.
just quickly, briefly introduce yourself.
Hey, Michael, great to be here. Thank you for having me on. And I am Darren Schaupp, founder and CEO of SiteLabs, based in the Clemson area, South Carolina, so not too far from where we had the pitch party there in Charlotte. And that's where we are.
Awesome. Well, it was totally clear when you were giving your pitch. You've thought about, you've worked really a long time. Your expertise shined within healthcare, global health systems, congratulations, first of all, because there was a lot of startups that entered for the Health Innovation Pitch Party. So really, kudos to you and your team and all your hard work.
Thanks, Michael. That was a real honor just to be there. I think Advocate Health coming in and supporting what's going on in the startup ecosystem, some of what they're building there in the Charlotte area is really cool. Kepler team, I see them every place. And Olga's been a real supporter and encourager along the way. So just kind of bringing all of those pieces together and see a lot of interested parties there at the Heart and Vascular Institute was really cool.
Yeah, no, it was super awesome. So tell us a little bit your journey. I mean, obviously, we don't have, short journey from where you started, to where you are now.
Yeah, it is a little different. I've had numerous people tell me, "Oh, you're not our typical startup CEO," and I totally get that. So most of my career was spent overseas in Africa, Southeast Asia, either living or working, and particularly focused on neglected tropical diseases. So my background is more on the anthropology side, but what I found myself doing in my journey is overseeing more programs in research and innovation. How do we impact people at the fringes of the health system with diseases like leprosy, leishmaniasis, Buruli ulcer? And that ranges from remote parts of the Congo to Myanmar. And how do we actually take some of the best in the world innovations? So think about the miniaturization of molecular diagnostics for these complex diseases and get them out to the fringes of the health system. And that's what I'm passionate about. So I was overseeing research, innovation, new ventures in that nonprofit global health space. And part of what I learned from our colleagues, my colleagues and friends in Africa and Asia is, first of all, leverage existing networks. Like that, the way that they thought creatively about how to do things in resource constrained settings, I just learned so much from them. And that kind of spawned what we're doing now with SiteLabs, but there were just so many lessons in that overseas environment. Not only the passion for how we bridge gaps in access to care, which is what I've given my life to and what I'm passionate about, but also how you go about it. And so I'm so indebted to my experience, my friends and colleagues around the world.
Well, I was really inspired by your pitch and not only your expertise, but really there's been such a conversation about we're losing, pharmacies being gobbled up by the big, whether it be Walgreens, CVS, the big mega, and yours is really more of a telling story of there's hope and light with the power of independent pharmacists and pharmacy and using your platform, your technology. You want to share more about that?
Yeah, and again, I'll just give kudos to the people I've worked with over the years, and the way that pharmacies are used overseas is much more creative than the way we use them here. So that's kind of where part of the initial piece of the idea came from for SiteLabs and leveraging independent pharmacies to increase access, is that because there's not enough physicians, they have to use pharmacies more creatively. And so that's part coming back to the US and realizing, oh my goodness, that is an underutilized network here in the US is mom and pop pharmacies, independent pharmacies. What's counterintuitive for most people is, and this is a big narrative, is that mom and pop pharmacies, these independents, are dying off. right? Chains are growing and mom and pop, and actually the data is exactly the opposite. You look over the last 10 plus years, independents have been on a growth trend and are just continuing to grow, even if it's slightly. There's a little over 23,000. So about 1 in 3 of all pharmacies are independent. And the chains have been in a slight decline over that period. In fact, we've heard a little bit more recently about more closings. There's a lot of discussion about why that is, where they are. And that was the other thing that really struck me about independence is the CDC estimates that 56% of them are in what are considered socially vulnerable areas, right? So that is areas that have underserved communities, underrepresented communities, and that is really, really powerful. So you're talking about a pervasive network that spans across the US, about 23,000. They touch about 115 million people every year, a third of the US population, and the majority are in socially vulnerable areas. Like, this is exactly what we want to do. If we're passionate about increasing access to care, oh my goodness, we've got to really leverage that underutilized network.
Yeah, I love this. And so tell me, like you were mentioning some of your services, some of, whether it be screenings, I mean, you don't have to list the whole laundry list
Sure.
of those, but just can you give people a better understanding of the sort of problems and things you're solving and doing and helping get those jobs done for a pharmacy?
Yeah, so very simply at SiteLabs, our vision is, and well, this is our mission to accomplish this, is change access to care for 100 million people through this network of independent pharmacies. And the way we do that is we have the network, and then we provide the technology which allows pharmacies to do simple point of care testing and screening. So think about screenings for things like diabetes with A1C test or cholesterol testing for cardiovascular disease. These are all simple, can be done right there, either at the pharmacy, or pharmacies can actually do that using our software and the test, do that at a local employer or school. We've done a zoo, it can be done anywhere through this network because of that high trust in the community. And then they can handle the referral process. How do they connect that patient to care? So that kind of leveraging that network and providing them the technology that enables them to do that, and then connecting a patient to care. That's what we do, very simply. What's nice is that platform can be used a lot of different ways, obviously.
Do you do labs as well?
Yeah, interestingly enough, LabCorp came on as an investor of SiteLabs back in 2023. And part of what they saw is like, oh my goodness, as LabCorp, they have 2,100 patient service centers through the US. Well, we've already have contracts that cover over 14,000 of these pharmacies. And they're like, why don't we leverage that existing brick and mortar out there? And that expands access to lab testing. So we're working on connecting that with LabCorp's pipes so that we can offer all kinds of lab tests then through our platform.
That's awesome. I'm seeing so much of these like longevity companies that are wanting to do all that. And I don't want to say they're the wrapper, the wrapper from LabCorp, but I imagine in many ways there are. With your, I know you are growing, you're strategic. You mentioned different ways through payers to probably also satisfying potential with the ACOs or the value-based care or payers with the stars, helping them, close those gaps of care. Those are regional or nationwide, or how are you looking at strategizing to go out and grow your network?
Yeah, Michael, this is right at the heart of the matter, right? So it's one thing to do this in one location, but how do you truly do it at scale? Mm-hmm. And that's part of why we started with getting contracts that cover these pharmacies, is because that's the power of this network. They're not one-offs. It really is a pervasive network if you can utilize it that way. So that's, first of all, we wanted to establish a network that truly can have nationwide impact to reach that 100 million people. But then secondly, it's not just the network and the technology, it's an economic model that can drive this at scale. So what we've done is we flipped the model. First of all, there are other companies who are out there trying to help pharmacies do screening and testing and then bill insurance. And that has its own challenges. Like we've experienced that of what that's like, to that regulatory battle for farmers to be able to do, or pharmacies to be able to do medical billing at their pharmacy. It's a challenge. It is the pathway of where things are going, but that's going to be a barrier to scaling. What we did, and I think you may remember this, is we have an agreement, like, for example, in North Carolina, they're with Cone Health near Greensboro. And our core customers are health systems, health plans, and pharma companies. Those we know, they're interested in accessing the 100 million people that we serve, and the 100 million people are interested in accessing the services that they provide. So we are that bridge. What we do, where we flip the model, is we get the upstream players like health systems, like a Cone Health, or health plans, pharma companies, to pay us to pay the pharmacies to do screening as a service on their behalf. And that's where it's really fundamentally changed the game and allows us to scale. So we started that with health systems. We're in conversations with a few health plans and ACOs, payers, and then we're getting ready to launch our first pharma contracts as well for clinical trial recruitment. And that's super exciting, because it's like, these are communities that don't generally have access to participate in clinical trial, at least the opportunity to participate. And we're getting ready to launch that in June, our first one.
It seems like that's a way better, smarter strategy versus trying to figure out all those codes to bill. And then if you get approved in it just seems like you're going after three huge stakeholders and satisfying them. And really, I think that seems a lot better, especially when you talk about value-based care and the evolution of delivering,
100%.
getting things done. What about regionally? Like I'm in Virginia Beach. How do you roll that strategy out with geography?
Yeah, great question. That's one of the advantages of just having pharmacies all over. So I'll give you an example from back during COVID. We launched about 4 years ago, and quickly that we recognized that was the immediate need, both for people and for pharmacies, is how do they do COVID, flu, et cetera, testing as fast as possible. So we became experts really quick. Here's an example of how we leverage that network regionally. We won an award with another partner to do testing for unvaccinated employees in New York, for the state of New York. And so their question was, how do we do that across the entire state? Very diverse geography and demographics. So we could reach out to 1,700 of our pharmacies through our contracts and choose 115 that we wanted to deploy for this and get them signed up very quickly and start testing. Like, that's the power of leveraging this network type approach. And so thinking about Virginia, that's very easy to do, whether we're targeting a few counties within a geography or we're doing statewide. There's one pharma group we're talking with now about doing nationwide screening. And that gets really, really interesting, because that truly leverages the power of this network.
I'm thinking of a good buddy of mine who has a specialty pharmacy for older adults, the dual eligibles, and he delivers in the western part of Pennsylvania. Do you see more opportunities for that, or is he too small, depending on, I think he has like 1,500 to 2,000 clients or so. But it just seems like I hope we see and hear more of that,
Totally. Yeah, no, that's right in the sweet spot. So think about it from his perspective, and I'm just inferring based on, we've talked to hundreds and hundreds of pharmacists over the process. Like, most of them want to practice at the top of their license, and they want the opportunities to also offer a diverse set of services to their patients. And that's more than just putting a pill in a vial, right? it's going beyond that to really take advantage of all of the clinical training that pharmacists do. And then how do we deploy that? So for your friend there, that he's already thinking, okay, how do I get the services to patients, like through home delivery, maybe homebound access? Well, this is exactly where we can help him offer additional types of services. Like those screenings can be done right in the home. Sometimes it's just a matter of surveys, doing a social determinants of health survey, which can all be done through our platform. Or in this clinical trial opportunity, that would be one way to potentially enroll an older set of patients that could be eligible for colorectal cancer screening, things like that, that are on the table. And I think what that does is not only expands that access to services for his patients in his community, but it also diversifies his revenue streams. And that is absolutely critical to sustaining these interventions. If we do health equity, and I really don't want people to miss this, because I think this is our model typically, even overseas, or especially overseas, is we do these health equity approaches and we base it on either grant money or philanthropy. And eventually they die out. But if you can root it in a viable economic model, like you understand the economic drivers and you treat it as a market-based approach, it can be transformational and really sustain that intervention.
Mm-hmm. What is, as a founder, is there been anything that been like an aha moment, or with you have a hypothesis, you started on this journey, anything that you were not, just kind of blown away with, any discovery that you think is worth like you sharing today?
Oh my goodness, there have been so many, so many. I'd had such great experiences and learnings overseas. Like that's part of my background. I had both just to go as a learner and always be learning from the people that you're working with, the people that you're serving. And I just feel like I've gained so much from my interactions, both with independent pharmacies around the nation, people in the communities who are looking for ways to access health. So I'll tell you about one recently. And here's also, this is a story about how the process works. So I'm at a screening event that one of our pharmacies is hosting, and this young man walks in. I'll call him Jahim. He walks in and he comes in and signs up to do the screening. And within 10 minutes, he registers. Has a finger prick test. He gets his A1C checked, his cholesterol, blood pressure, BMI, and he's done. The results go to his phone or to his email. And I asked him, I think this is a young guy, seemed pretty healthy overall, and I said, well, Jahim, why did you come in to get screened? And this is a free wellness screening sponsored by Cone Health in that area of North Carolina. And he said, man, I've been meaning to get checked out, but I can't afford to take time off work. And my parents keep bugging me and want me to come in, but it's just so hard to get that time and get that scheduled. And it's expensive to do that. And I think one of those ahas is sometimes we have all of these complex reasons for why maybe people in certain communities don't want to participate in their healthcare, or they're unengaged with healthcare. And often it's those simple things, like just a simple barrier to access, like accessibility, like the timing of it, where it's happening, that can really unlock things for people. And so that's one of those things I just constantly learn, is sometimes my assumptions are just wrong. Mm-hmm. And getting your boots on the ground and actually engaged in the process can help really open my eyes continually to, there's actually different things going on here, and it is potentially solvable.
Yeah, I love what you're saying. It makes me think of how they've had a lot of uptick with speculating about health equity and access with barbers doing, really change. Why does healthcare need to be?
Example?
Yeah. Why does healthcare have to happen the moment you do that, you're biasing a whole group that it has to be in the clinic around the time.
For sure. So I love that example.
Yeah. So, really glad you're here. Again, congratulations for your success with the Healthcare Innovation Pitch Party. You were, there was a lot of startups that applied for it. You were one of the 6. Anything that you, as a founder, what do you do to, kind of, what is your edge? Where do you like keep being fed, as a founder? I'd love for other founders to connect with founders. There's so many different people that listen to this.
Yeah. I mean, first, I think part of it goes back to me being a learner. I am absolutely energized by learning from other people. And I mean, you meet so many, especially younger people starting the founder journey, who I just feel like I continue to learn from them. If there's ways I can contribute and help provide input from my experience, great. I love to do that as well. But boy, do I just soak up energy from other people who are trying to tackle big problems. And I love that part. So always happy to have people reach out and connect on those regards. And I think there's just a lot of things like the pitch party where you're bringing together like-minded founders, startups, healthcare practitioners who are in the space. And then you've got kind of the venture side of things where they're trying to figure out, how do we fund the next thing? How do we really put resource behind it? I mean, I find that whole ecosystem really, really powerful. Can it be frustrating? Oh my word, yes. Oh man. Yeah, the ups and downs of startup life, it's that roller coaster. This is awesome and we're all gonna die. This is awesome, we're all gonna die. And that is part of the journey.
Well, where, in the next 3 to 9 months, what are you really working hard on? What would be, if, you're here, talking, and anyone in the audience, whether it's an investor or potential partner, what would you like to say?
Yeah, for us, everything is about the contracts that drive this. What we have access to is that 100 million people through this network of pharmacies. So for healthcare leaders out there, of health systems, health plans, of pharma companies, we would love to talk to you. If you're struggling to reach patients in your community, I was just talking to one healthcare exec actually earlier this morning, and he said, truly, what the patients that you're reaching in our community, just the sheer quantity, for them, it was like over 4,000 in a pretty short time frame. It's unprecedented. Like, we've never had so many unengaged people that have agreed to be screened and been screened. We're getting that real-time, real-world data. I find that super exciting. So would love to talk to health system, pharma, and health plan leaders who are really passionate about accessing patients, closing care gaps, reducing that cost of care. That's what we're here to do. We're on a mission to do that for 100 million people, and it's going to take a real innovative team to make that happen, and a real collaboration to make that happen.
I'm curious, what is your research from your efforts with your company? Any opportunities just for enrollment? I know these plans spend so much every time during open enrollment. I could see a pharmacy being a great place to do that.
Sure.
Any conversation with that with your organization?
We're still really early in our conversations with health plans and payers. The conversations we've had so far, that has come up from other experts in the space. But the conversations we're having so far is, for example, how do we change nationwide colorectal cancer screening rates, which we can absolutely help with. Those rates are abysmal in many communities. We're getting ready to participate in a clinical trial around that, but I think for health plans, it makes total sense. Enrollment is a whole other area. Like, I love the way you're thinking about it, Michael, because that's that network as a platform approach, right? We're the pipes and rails, that infrastructure, that can be leveraged to increase access. And that's
Mhm.
both ways, from healthcare companies to patients and from patients to healthcare companies.
And I'm just thinking as a, curious, just really the pharmacist, that pharmacy provide that is a education, isn't a resource as a to our community. So it's just even them rediscovering who or what they could be. I mean, when I think of a pharmacy, and I've had guests, and there's another podcaster that does all things pharmacy. I need to connect you with him for sure.
Yeah.
But the my dad, that was one of his first jobs. He's
Is that
92.
right?
Yeah, he was
I love that.
this is what were they called, a jerk, or what do you call them, a soda jerk
A
or
soda
whatever?
jerk? Yeah,
Yeah, I guess
sure.
at some point at the local Main Street. I mean, that was the hub of all things, every town in America, and why not today? I mean, anyway, it sounds like there's a great hope.
Mhm.
I feel a lot better, Darren, talking to you about pharmacy being the independent local pharmacy. I mean, bring back America. Let's bring the pharmacy to your company. But anyway.
Yeah, I love it. And I certainly don't want to just paint a rosy picture that everything's easy for independent pharmacies.
Yeah.
They're under extreme pressure. And I hope this whole PBM regulation and all of that they can really just kind of figure out how to do that the right way. But at the same time, there is a lot of hope, and they're heroes in the local communities. Like they just are. They're sponsoring your local little league teams. They're engaged in community organizations. They give a lot back to the community, and there's just enormous potential for them to even play a greater role.
So how do you I know you definitely would like to talk to some big health plan leaders, executives, some, the pharma, and of course, more and more independent pharmacies. You want to build that network. How do you mentioned the clinical trials with colorectal and rectal screenings, but how is it that you come up with another, like, job to be done, or how does that look? Where do you decide yay or nay, or go or no go?
Well, part of this is my philosophy around the drivers, like the sustainable drivers. There has to be an economic engine behind it. So understanding not just what the great health needs are in the communities, but is there an economic model to make that engine move? And that's where it does get a little tricky, right? There are a lot of things that can be done, but not everything is viable economically. So that's why we're kind of focused on those areas. So I'll give you an example. Chronic disease accounts for, so think of diabetes, cardiovascular disease, hypertension. They're truly at an epidemic rate in the US. And 2 out of 3 people in the US already suffer from one chronic disease. There's enormous resource put behind it. And right now, the estimate is that untreated chronic disease accounts for about $3 trillion of our healthcare spend. So out of 4.5 trillion, 3 trillion are on untreated chronic disease, which is preventable chronic disease. Like, that's where and so we feel like even this focus on kind of A1C, cholesterol, blood pressure, BMI, that's part of why health systems are paying attention to this and others, is that actually, if we do this nationwide, we can probably shave, just with that 100 million people, we can shave $1 trillion off of our healthcare spend. And we know that's really, really powerful. So we do think about, there's a lot of ways to leverage this network as a platform, but making sure that there's truly an economic engine behind it is critical.
Yeah, and I think you're doing it the right way. The pharma or payers, or those stakeholders will tell you. You'll find out quick.
Yeah.
So you're doing the right thing. You're approaching the right way. As we're wrapping up, how do people find you? Tell us, tell us how you want to be found, and tell us about where they can get you.
Yeah, well, anybody can go and check out our website at SiteLabsGlobal.com. That's an easy way just to kind of see what we're doing. But yeah, reach out to me by email, just first initial, last name at sitelabsglobal.com, and would love to get in touch. Or, ping me on LinkedIn. There are not many Darren Schaupps out there, that I can guarantee you.
Well, this has been really amazing. I really appreciate you coming on, Darren. This has been a great conversation.
Yeah, appreciate it, Michael. Appreciate what you do in telling the story, getting it out there.